Mr. President, last week the Senate confirmed Sylvia Burwell as our new Secretary of Health and Human Services. She is now the administration's main interpreter and representative of Obamacare. She's a new face and will be its primary salesperson to the American people. I think the President made a competent choice, and I supported her confirmation. But I think I would be remiss if I did not mention or bring to light the difficult job she has ahead of her. From its botched website to ever-increasing premiums to canceled health insurance plans, Obamacare has been and remains a complicated mess of broken promises and confusing implementation. I was back home in Indiana last week and the weekend, and the week before that. Obamacare remains, along with complaints about overregulation, the top two things on people's minds. Friday, I was in DeKalb County and Noble County up in northeast Indiana, meeting with representatives of those two counties and communities that sort of cross the spectrum of people engaged in various business enterprises, housewives, small business, big business, elected officials, et cetera. And each of those discussions, as I went across those two counties, as I said, overregulation, but Obamacare were number one and number two, or vice versa, on everyone's mind. And it continues to remain on their minds because they see this as a very complicated and messy intrusion into their individual lives and in terms of their ability to run their businesses. For many, it's not a question of Obamacare not hurting them, but how it has hurt them and their concerns about how it's going to hurt them in the future. Now, the President promised us that this plan would, and I want to quote him here, lower the cost of health care for our families, our businesses, and our government. Let me repeat that. The President said that the Obamacare would lower the cost of health care, which it hasn't, for our families, our businesses, and our government. But that is not what I have heard as I talk to people across the state of Indiana. What I hear from Hoosiers are that their premiums have increased, they have higher health care costs, their deductibles have risen dramatically, their co-pays have risen, and they have fewer provider options. Remember when the President said, if you like your doctor or your health plan, you can keep it, period. That is not the case, and I hear that from hundreds of Hoosiers as I travel around the state. Let me talk about a specific story from a constituent. Jeremy from Randolph County, Indiana, said this, and I quote, "My plan for my wife and two kids, age 2 and 5, has increased from 150 to $615 per month. We can't afford this massive hike," he said. And he went on to say, "Something must be done to lower these plans because we are seriously going to think about not being able to have insurance for the first time since college because I simply can't afford it." It is unaffordable, he said. The ACA, the so-called Affordable Care Act, has been called unaffordable by so many Hoosiers, and I suspect that that's true all across the country, that they ought to rename it. Not the affordable, but the unfordable, a Care Act. I don't know how many stories we have to bring here to the floor of the Senate before my colleagues understand and realize that this plan is faulty to a point, needs to be replaced, is deeply and fatally flawed at its very core. Now, I know the majority leader came down and said, none of these stories that we relate to are true. Well, that's like telling Jeremy he doesn't exist. I don't think he made this up. My plan for my wife and kids has just increased from $150 a month to $615 a month. It's unaffordable. I'm going to have to, and of course, Americans across the country are repeating these stories. They're not made up. It's not something the Republican Party sits around and writes in the back room and sends out to somebody, here, say this, so we can repeat it on the floor of the House of Representatives or the Senate floor. These are concerned citizens sending by the thousands emails, phone calls, tweets, and any other means of communication speaking to us directly when we go back home, whether I'm in the grocery store buying a quart of milk or picking up a newspaper at the gas station or just talking to people on the street. When I sit down with business people that we've invited from the various small towns in Indiana, as I said, these stories that are coming from real people that I represent, and they sent me here to represent them, is the impact of the health care plan that has been proposed by the president and now is being implemented. So all the promises that were made early on when it wasn't in force have now been proven to be untrue. Now, don't just take my word for it. Look at the headlines. Reuters, which I don't think is an arm of the Republican Senatorial Committee or the National Committee, it's an independent newspaper. Reuters says, and I quote, "The United States, there are 2.2 million Obamacare enrollees have data problems. 2.2 million have data problems with the Obamacare." CNBC, last time I heard they weren't making contributions to the Republican Party either. 7 in 10 people say Obamacare had bad or zero impact on the U.S. Either nothing, no impact, or bad impact. That's 70%. Indianapolis Business Journal, which I pay attention to, independent organization, Indiana's Obamacare rates for 2015 are all over the map. People can't figure out how much they're going to have to pay next year, but they have figured out one thing. It's going to be more than they paid last year. Remember that statement? Premiums won't go up, won't cost a penny. Well, I think many of us think it's time to start over and replace Obamacare with real health care solutions. Now, Republicans had offered a multitude of possibilities, of suggestions and proposals. Every one of has been turned down by the president or not allowed to be brought to the floor by the Senate Majority Leader. So for those who say, well, you know, what would you do? Why don't you suggest something? We have tried our very, very best to bring forward packages of reforms, to reach across the aisle and say, if you'll work with us, we will try to fix some of these problems. We think we should repeal it and start all over because we don't think it's the right model for health care to address the solution of providing people in this country with adequate health care at a reasonable cost. So changing the face of Obamacare just from putting in a new Secretary of Health and Human Services will not change this law's negative impact on Hoosiers like Jeremy. I wish that it would, but obviously it won't. And it will not change this disaster of a law into what it should be, better health care for all Americans. We're all committed to that goal, but we simply are saddled with a piece of legislation that was very poorly drafted, that was rushed through without any support or comment from those of us on the other side of the aisle. I wasn't here at the time. One of the reasons I did run and come back to try to address what I thought was something taking us down a road to a dysfunctional healthcare system with less quality, less access, less choice, less competition. Are there needs to reform our current healthcare system? Yes. Are there solutions that are better than what has been put before us? Yes, and I wish we could summon the support and the will of those in this body to begin addressing that very problem. Mr. President, with that, I see my colleagues on the floor, and I will yield back. Thank you.